Hi, everyone, and welcome to Building Hancock, Stories of Growth and Community, the podcast where we shine a light on the people, places, and projects shaping the future of Hancock County, Indiana. I'm your host, Dave Meeker, and we're brought to you by Bringing Tech to You, New Pal Open for Biz, Advocast, and our title sponsor, Hancock Health. Steve Long is the president and CEO of Hancock Health, where he envisions Hancock Health leading the way in healthcare innovation, both regionally and nationally. Under his leadership, Hancock Health has become a beacon of proactive healthcare, aiming to make Hancock County the healthiest in Indiana. His vision is not just about healthcare, but about creating a supportive community where people can thrive physically, mentally, and spiritually. Leading the conversation today is my co-host, Sean P. Neal. Sean is the CEO of Advocast, a strategic communications consultancy helping organizations build retention, engagement, and trust. So with that, I'll step back and hand it over to Sean. Sean, take it away.
Steve Long, President and CEO there at Hancock Health. Thank you for joining me today.
It is great to be with you today.
Likewise. So we've got a lot to cover, a little time to cover it in, but I think first of all, let's just kind of do an overview. I know you've led Hancock Health with a strong focus on kindness and community. So before we go any further and get into this, what would you say it is about Hancock's mission personally that resonates with you?
Our unofficial motto is, what a blessing it is to work in a place where we love people for a living. And that says everything you need to know about Hancock Health.
That's huge.
Yeah.
That's huge. If you come at it from, and I'm a firm believer in, you write your destiny, your biography is not your future. And so when you come at something with that approach, I think that just cements everything from the start as to where this is going.
It sure does. And I can tell you it's been that way since the very beginning, back in 1951. And if you look at our mission and our vision, it has the word kindness in it. And in fact, our vision says we will be nationally recognized for kindness.
Wow. All right. So great place to launch off, because the Hancock Wellbeing at Work program is kind of rooted, I think, in this kindness for the working community there in Hancock County. Can you talk a little bit about the Wellbeing at Work and how that came to be, and what needs you were seeing in the employer community that kind of brought this in?
Yeah, you bet. So it's really fundamentally rooted in our desire that Hancock County be the healthiest county in the state of Indiana. That drives virtually everything that we do. And we started a journey about, 10, 11 years ago now to create a blueprint to achieve that goal. And we measure our progress through the county health rankings. And at the time, we were 28th in the state of Indiana, which isn't horrible, but we were 28th. Interestingly, at the time, we were the 5th highest average income, and these things usually are correlated. So we developed a blueprint to achieve that goal, and we did it in concert with the Mayo Clinic. So we've known them for quite a long time. And we also partnered with the Wellness Council of Indiana, which is part of the Indiana Chamber of Commerce. And in the process of developing that blueprint, we developed a number of teams. And one of those teams was Wellbeing at Work. And we discovered that when you really look at what was top of mind for most employers that provided healthcare coverage, which we all know the small ones do not, it was the cost of the healthcare benefits that they provided and how there was so little control over it. And we firmly believe that if we're going to make Hancock County the healthiest, we have to do it through workplaces as well as at home, and that we had to have partners in the workplace. And we immediately ran into the insurance company as sort of a wall between us and the employers and their employees. So over the years, we have developed this concept of a direct primary care, and we call it our employer strategies. But really what it does is it says, how do we go into an employer and say, let's get your employees enrolled in a direct primary care clinic, because access to primary care is absolutely essential. How do we take care of the bread and butter lab, imaging, pharmaceuticals? And then how do we layer onto that an exercise as medicine program? We're one of the few healthcare systems in the country that has invested heavily in wellness centers, which I can tell you about before because it's inextricably related to our economic development focus as well. But it all came out of that desire to be the healthiest county in the state.
Yeah, and you're hitting on so much. There's so many talking points in there. One specifically that caught my attention is, we look at this kind of proactive healthcare, and we've talked about. I've heard this circulating in the medical community for many years now, that the future of medicine is being proactive before we develop some of these chronic illnesses and things. So when you think about what these I think what these programs have done, these clinics have done, is there a particular story or something that stands out when you look at it and say that was like one of the hallmark moments of exactly why this was needed in our community?
Mm-hmm. Let me give you a little bit of an overarching story and then a specific one. So to the point that you just made, here in America, we have the most phenomenal and the most horrible healthcare system in the world. It is phenomenal because we are the very best at doing things. If you are very sick, there is nowhere that you should be rather than in the United States of America, because we can do things nobody else can do. And we have become, as a nation, we've come to a belief that we all need to have that, regardless of whether it's expensive or not. So we have taken this system that we have developed to do things, and the more interventional and invasive it is, the better we are at it. And that means it's more and more expensive. And we have laid on top of that a chronic disease epidemic, so that now 80% of what we do in the American healthcare system is treating diseases that could have been prevented. And when you look at the $4.9 trillion we spent on healthcare in America last year, just imagine if 80% of that could have gone away because it never happened. It's a huge, huge deal. So just keep that in mind. So the story I will tell you is with Mount Vernon Community Schools. So they are up in McCordsville and Fortville. They have schools actually in two of the townships on the west and northwest corner of our county. And they had issues with their health insurance, right? They did not feel like they were getting value from the dollar that they spend. And as we all know, that dollar's going up. I will tell you, back in the mid-90s, if you got an employer-based family health plan, it was costing about $6,000 a year. And the out-of-pocket was about $1,500, including premium. And today it's $23,000 a year. And we're all spending $6,000 out-of-pocket on premiums. And so anyway, we had developed a relationship with them. And so we entered into this direct-to-employer contract. And it has these direct primary care clinics that all of their employees and their family members can go to now. And it has access to our low-cost, high-quality imaging and labs. It has access to pharmaceuticals. Most importantly, it has access to our wellness center in McCordsville built in. And they are seeing demonstrable improvements in the health of the beneficiaries on their health plan, as well as containing their cost.
Yeah, that's amazing. And so my wife is an educator, and I know how valuable that can be. That is immensely incredible. When you think about that and you think about what you've been able to accomplish, and then you look, forward 5 years, let's say, with the Wellbeing at Work program, what kind of things would you like to see develop, or what would be maybe that future vision for it as it goes forward?
So that the most important part of it is really access to primary care. So what we have discovered is that I'm going to blank a bit on the percentage, but it's upwards of 60% of Americans do not have a primary care doctor, which means no one is proactively watching over their health journey. And then you layer into that we all live in these environments where the unhealthy choice is incentivized. And so you're not watching out for your health, or living in an environment that encourages you to make bad decisions. And then we end up with this chronic disease epidemic. So number one, primary care. And we want to make that cheap. We want to make it easy. And we want to make it just a part of what people do. And then we put on top of that access to this exercise as medicine program. So I will tell you, and I had mentioned, we have invested in wellness centers. We now have 3 of these in Hancock County. Total membership right now is 16,250.
Wow.
They are on track to visit us 750,000 times this year between those 3. And when you walk in the door, it's like walking into a amalgamation of a Gold's Gym and a primary care clinic. I mean, it's just incredible. And it's to the point where our doctors have the ability to walk a patient out their office over into the wellness center and get them started with us. And it's a 60-day program. They get hooked up with an exercise specialist, a rehab therapist, and a nutritionist. And 60 days later, they have made demonstrable improvement, and they mostly become members at that point. And it's a member-based organization.
That's incredible. That is truly incredible. Congratulations, first of all, to you and everyone that was involved. I know it takes a team. So congratulations on that.
Well, thank you. It does take a team, and it's been a long time. Let me give you one more thing, is that we have been committed to these ideas for so long that Hancock Regional Hospital was the first hospital in the state of Indiana to prohibit smoking on our campus. And Hancock County was the first to prohibit the use of tobacco products in our public buildings. So we have engaged the entire community in this for a very long time now.
Wow. Truly amazing. And what we know is that when your employees are healthy, when, and we're not just talking physical, we're talking mental well-being as well. Mm-hmm. The outcomes in the work that they do and the fulfillment in life that they find is so much greater. And kind of shifting into that perspective, let's kind of talk about patient experience there at Hancock Health, okay? Because what I have seen from you, I watched you at a Chamber of Commerce meeting there in New Pal. Yeah. I've seen some of the things the interviews that you've done, and I'm looking at kind of the internal health of the organization there. You've got culture, mm-hmm. the morale, the communication. How much of that patient experience do you see shaped by that internal health, if you will, of Hancock Health?
Almost entirely. So you recall that I said our unofficial motto is, what a blessing it is to work in a place where we love people for a living. Love for us is an acronym, living our values every day. So we actually have this document. It's called the Love Promise. And we say, what does it look like to live our values? So our values are that we will be exceptional, honorable, devoted, reliable, and kind. So the Love Promise says, what does it look like to be exceptional? And what does it look like to be devoted? What does it look like to be kind? And we actually list those out, their behaviors. And then every single person that works here signs it, including me, and it's in our file. And we hold each other accountable to this idea. Not only that, but our entire strategic plan as an organization is only 5 words. And it is clinical excellence, population health, and love. So it is part and parcel of everything we do.
Well, okay. So I had no idea this interview was going to get to me like that. That's incredible, Steve.
Yeah.
So, okay. Well, you've really thrown my game here, because I run into leaders, throughout my work where it's spoken, it sounds good on the company values list, but when you see it executed at such a level like that it's, we are holding each other accountable for this every day. Mm-hmm. Wow. That's moving. That's incredible.
Well, thank you. We're not perfect by any means, but
no, but I mean, that such is life. I mean, that is such an aspirational thing that I think every leader out there, everyone working should listen to, even if it's not written in the documents. Just take that mindset to work with you. Goodness.
Yeah.
You've got multiple locations there, and you've got a very diverse workforce. How do you keep some of these values so alive with all these different touch points across the org?
So let me give you an example. Every day we have a daily safety huddle that has the majority of our leaders. And 4 days out of the week it's virtual, but 1 day out of the week we do it in person, and it's in the hospital cafeteria. We block off a piece of the cafeteria. And we start off with a reading of our mission and our vision, and then we all recite the values together. I mean, it's kind of an interesting, fun thing. But when we have our all associate meetings, it starts off with our mission and our vision and our values. When you look at our board agenda, at the very top is the mission and the vision of values. So we keep all of this stuff top of mind all the time. And we understand that everything we do here is about people.
Yeah.
Everything else is important, but fundamentally we are here for people. And let me tell you this too, because this is a personal thing for me, is that I have 4 kids and I have 6 grandkids and soon to have 9. And all but one of my kids lives in Hancock County, and all of my grandchildren live in Hancock County. And I want this county to be a place that they will enjoy living in. In fact, when we say we want to be the healthiest county in the state of Indiana, we actually say we want a decision to live in Hancock County to be an inadvertent decision to have a longer, happier, healthier life than if you lived anywhere else. That's what we're about.
Yeah. And it's represented obviously internally, as we just talked, but the things that we're seeing on the outside. So, the clinics and their availability to the workforce. Something else that I was just kind of alerted to was the behavioral health mobile response team.
Yeah.
And I would love to get some thoughts on that, because that is another way that you bring this concept into the community, the residents here in Hancock.
Indeed. So you may remember that I said that 10 years ago, we set out to create a blueprint to make the county the healthiest in the state.
Yes.
And one of the teams we had was the workplace, right? There was another one, which was mental well-being. And so that morphed into its own separate thing, because we realize that we are not just physical beings. We are body, mind, and spirit. And so we now have a system of care. So we have every not-for-profit social service, education, law enforcement, healthcare organization in our county meeting regularly to create a real safety net around the people that need us. Because, we find that we have families that use many different agencies, and the agencies never talk. So the families fall between the cracks. We've had that going for almost 10 years now. Out of that came a connection center. So we understand that when people are in the midst of a mental health crisis or a substance abuse crisis, the number one thing they cannot do is life. They do not do life well. They need somebody to walk alongside them in their journey. And it's not good enough that you go to the doctor and they say, here's a referral to go to the behavioral health counseling center. That person's never going to go. And we get them there, we follow up with them there, then we help them in other aspects of their life. Because when they're in the midst of these crises, they're not paying their rent, and they're not keeping a job, and they're not keeping their car. So we have this whole connection center that is nothing but that. It's a navigation resource for people that are going through that. And then we took it another step in a truly remarkable partnership with the county and with our law enforcement and with the judicial system. We now have navigation through our jail and through the judicial. And we have a mental health court. We have a drug court. And we actually, now here's a statistic that blew me away. So nationally, in America, if there is a person that comes into the justice system with a substance abuse problem, 60% of the time there's recidivism back into the justice system when they're released. Indiana's better. We're like 30%. But in Hancock County, since we have developed this partnership with the county and the jail and the sheriff's office, we're at 15%. And we see this play out in the lives of people every day. And then we take it even one more step, and we didn't expect this to happen, but we practice R&D here at Hancock Health, which is rob and duplicate. So we stole an idea from Memphis Le Bonheur Healthcare, and it's called the Congregational Network. So we now have covenant agreements with 32 churches in Hancock County. And individual members can be members of the Congregational Network. So when Mrs. Smith ends up in our ER and gets admitted to the hospital, our navigator goes and talks to her and says, Mrs. Smith, we see you go to Park Chapel Church. Would you like us to let them know you're here? And she'll say, yeah, that'd be great. So we call them and they say, oh, Mrs. Smith, we didn't know she was in the hospital, because, nobody does.
Right.
And they say, who's watching her dog? And we say, well, we don't know. And they say, well, we'll watch her dog. And we'll put her on the meal delivery list when she's out, and we'll put her on the prayer list. It's like this extra layer of love around the people. So, it has blossomed to the point where a number of years ago, I was sitting in a community meeting on a different subject entirely. I walked in, I sat down next to this young lady, and she had just come from a system of care meeting. And she didn't know who I was. And I introduced myself, and she said, oh, you're at the hospital. You should really be engaged in this system of care. I've never seen anything like it. And she said, it's a movement that I've not experienced. And I'm like, wow, it's become a movement.
Wow.
Yeah.
Yeah, that's got to make you just smile inside.
It does.
So I would love to just kind of address something that is, I think, buried within this conversation. And from the mental health perspective, we're talking SUD was a great example that you had mentioned. There is a lot of stigma that goes along with mental health. From someone who is leading the healthcare organization and this huge initiative in Hancock County, can you just speak directly to everyone out there about what that stigma means and how they can feel when they approach someone at Hancock Health about the things that they're experiencing?
As a society, if you break your arm, we say you need to go see the orthopedist. If you have appendicitis, we say you need to go see the surgeon. If you have a mental health problem, we say suck it up, right? And I will say it's been that way for a very long time across our country. And if there is one bright spot that came out of the pandemic, it is that we all figured out that we have the same hangups, right? And that we are all struggling with some sort of a mental health issue, some sort of a substance abuse issue. If not us directly, somebody that we know dearly is involved in that. So I will tell you what, we actually did a fundraiser. We did about a 3-year fundraising campaign to support our mental health initiatives here in this county. And it kicked off, no kidding, right when COVID hit.
Oh, wow.
And we thought, well, there's a double whammy. People wouldn't want to give to this anyway. Plus, now we got this pandemic. And, for the first, I would say, year of the pandemic, it was tough. And then it's like the floodgates opened up. And people all experienced, and then it became one of our most successful fundraising campaigns we've ever had. In fact, over the course of 3 years, it raised $4.5 million. The county put another $5 million into this thing, and then we at Hancock Health created an endowment of about $7 million, and so fully funded this thing. And we have, just tremendous impacts on the community. But I think it is because people have figured out now that we all have it. Now, is the stigma still there? Yeah, it is. But I will tell you, when somebody comes into our ER with any kind of a medical problem, we take everybody the way they are. But we don't leave them there, right? Our job is to help them heal. And please know, we have never healed anybody ourselves. People heal on their own. We help them heal. So we help people heal physically. We help them heal emotionally. We help them heal mentally. That is why we are here.
That's awesome. I really appreciate that. I know it's such a tough thing for people. So I love knowing, first of all, I'm going to flip the servant leadership model, which I can clearly see that you live by. I'm going to flip that back around and say this is a top-down thing where we hear it from, the person that influences Hancock Health the most. And we know that from there, it travels through the organization and that people can trust that when they get there. So thank you.
Well, thank you for saying that. It is all of us together.
Absolutely. So as we kind of wrap up our time, one of my favorite questions to ask, and we're going to get away from Hancock Health for a minute and just kind of go into Hancock County, this beautiful area. What would you say is maybe, I don't want to say the thing that you love the most about it, but maybe just the most endearing thing about this community for you?
So we've lived here about 11 years now. And we've lived all over the country. My wife and I, and when I was growing up, we lived all over the country. And various parts of the country are either accepting or not accepting of outsiders. Hancock County is remarkably accepting of outsiders. We came in, and I don't know why that is. Maybe it's always been that way. Lily was big here for a long time.
Right.
Maybe it's that. Whatever it is, I mean, just welcoming people that you'd come in and they'd love on you and it's great and you just felt right at home. It's been that way since the beginning. But it transcends that even, because there is this remarkable outlook in this county where we are looking into the future. So if I can give you an example, and I'm going to tie it back in the hospital a little bit, but this idea that we wanted Hancock County to be the very best place to live, work, play, and pray got so deep that in our county comprehensive plan, we included the trails plan for the next 40 years. And we have been building out a trail system because of that. And everywhere you go in this county, there are trails that are being built. And it is an amazing testament that people have said, that's important to us. And it may not be, many of these trails aren't even connected yet, right?
That's fine.
But they're going to be.
Yeah.
And we're investing in the future. So let me wrap it up with this. So you remember when I said that we were 28th in the county health rankings 10, 11 years ago? Today we are third. And our goal is still to be first, but we are third in the state of Indiana and 117th in the nation out of 3,000 counties. So the things that are happening in Hancock County work, and they can be done anywhere.
Yes, sir, they do. And it is in part thanks to people like yourself and the staff at Hancock Health doing the great work that you do. So I want to say thank you for being there, for taking time with this audience today, because I think this is so valuable. You are obviously an influencer in the community. You are helping to make things happen. So Steve Long, thank you for taking time for this.
Well, Sean, thanks so much for the opportunity. I really appreciate it.
At New Pal Open for Biz, we're all about creating a team of local businesses to help secure and promote one of the key gateways into Hancock County, our hometown of New Palestine, Indiana. Whether it's road construction updates, business growth, or community events, we've got you covered. And if you're a business owner in the New Palestine or Hancock County area and you want to be part of what we're building, just reach out by clicking on the link found in the show notes.